Hello, everyone. Thank you for being here. Welcome to our first IMG initiative, Sip and Solver series. Today, we have a very special guest. We have Dr. Robert Chow with us. He is in Maryland. And Dr. Chow, welcome. Would you like to introduce yourself and tell us what you like doing outside of your work?
Okay. Hey, hello, everyone. I apologize for the delay. It's totally my fault. I'm not very tech savvy, and I had trouble logging on. I'm a program director here in Baltimore. I'm at the University of Maryland Medical Center Midtown campus. I've been a program director for 17 years now, and been in Baltimore all that time. And I'm just honored to be here with you all today.
Thank you so much, Dr. Chow. And please don't apologize. We completely understand. And you're helping us a lot today as an IMG. I think we all can agree that having help and guidance with your personal statement is really invaluable. So whenever you're ready, you can share your screen.
Okay. Okay. All right. Are you able to see that?
Yes, thank you.
Okay. So now, just help me with the format here. So you want me to go through a discussion? Is the will there be? Let's see if I can figure out the chat.
Yeah, we will be helping with the chat. Definitely, like at the end of your presentation, we can answer to questions that might be coming up. Deborah and I here will be
Okay.
looking at the chat and everything. So please go ahead.
Okay, because I can't see the chat, but if you look as I'm going along, if you want to interrupt me with questions, that's fine. If you want to wait to the end, that's fine.
Thank you so much.
I'm glad either way, but I rely on you to prime me with the question, and then I'll try to respond. Now, I'll call on Dr. Ravi. He thinks he's going to get by, but sitting there just hanging out. But he's an experienced educator, and I'm sure that you all will benefit from his input as well. Okay, so I'm going to go through this presentation about what program directors are looking for in residency candidates, and I actually prepared this in February because that was the end of the interview season, and the interview season is a long season. And after you review hundreds of applications, you interview with hundreds of applicants, and then you're done with it, and you reflect on that experience, and then I thought to myself, hey, someone should talk to these applicants about what program directors are looking for, what their interest is in, or what their perspective is. And so so anyways, I came up with this. All right, so we'll go ahead. First, conflicts of interest. There's at times I'm a little bit sarcastic. Apologize for that. You'll have to excuse that. So we'll look at this from the perspective of from the ACGME perspective, from the program director's perspective, and actually it's sort of my own personal perspective, and you can take it for what it's worth. Yeah, and I don't know. I don't speak for all program directors in the country, and in fact, I don't know if you all are interested in internal medicine. I hope you are. It's a great specialty. I have zero experience with the other specialties. Like I certainly cannot speak regarding surgery or GYN or anesthesiology any other of those inferior specialties, which you don't want to go into anyways. It's all internal medicine, right? Okay, so related to this is the perspective of what the program directors are coming from. This is the ACGME is looking at it from this direction, and they look at it from the 6 core competencies. You guys have all heard about that, I hope. There's these 6 core competencies, and they expect a certain level of competency in each of these 6. And we'll go through this a little bit because I think if you're not familiar with these core competencies, you should. It'll help you with some leverage when you think about writing a personal statement when you go to the interview. That this is the perspective that the faculty will be speaking to you from, and because they fundamentally, what do they want? They want at the end of the day that you go to their program and you become a high performing resident. And so what does that look like? That means that you have competency. And what does competency mean? That you have competency in these 6 core competencies. So what are these 6 core competencies? So I'll go through each of these. So first one is patient care. And you can read all this, but basically patient care is being able to do a history, do a physical exam, come up with a differential diagnosis, and then come up with a assessment and plan. Now that's how do you gain that? How do programs assess whether you have that competency? So it's hard, right? They depend on your evaluations from your medical school. They depend upon the evaluations from faculty that you work with. They read the letters of recommendation, and they try to make an assessment about whether this student, this applicant, has the capacity, has the competency in patient care. This is the competency that these morning report sessions tries to teach. That's why I love these virtual morning report sessions, the clinical problem solving questions. I don't think they focus as much on medical knowledge as they do on this competency, which is trying to establish a differential diagnosis after you have some information in hand, and then try to tease through that and come up with a assessment and plan. It's an art. It comes from experience. It comes from being with patients. It comes from mentors. I don't think you can read about the patient care competency from a book and then become competent in patient care. Next competency is medical knowledge. All right, so you're very familiar with the competency of medical knowledge. Now, how do programs figure out, are you as an applicant competent in this particular competency? Well, they don't know for sure, but they do use test scores as a way to evaluate this competency. So you can become very proficient in medical knowledge by sitting at home or sitting in the library. You read the books, you study, and you can gain medical knowledge without being in front of a patient. So of all six core competencies, this is the one that you can learn from a book. The others, I will argue, that you have to be in the clinical arena. So because this is the one that tends to be that people can quantify with a test score, then this competency receives a lot of play. It receives a lot of attention, right? There's a lot of focus on test scores. Well, unfortunately, there's good and bad to that. The other competencies, the other 5, it's hard to quantify those numerically. Now, I'll say this, from the ACGME standpoint, each of the 6 competencies stand independently. They are equal. So you can be at the absolute pinnacle in terms of medical knowledge, but if you're at the low percentile in the others, and one of the others, then that will negatively affect your overall competency. Systems-based practice. So what is that? That's working in a system of care, being a team member, integrating into a team. Now, I have found this to be challenging for students who come from international medical schools. We have residents in our program who are all from international schools. And when you come from a background that's different than the US hospital, it takes some time to understand what is what your role is as a resident. What is the role of the social worker? How do you access pharmacy to help you? There's and understanding the different roles of the different members of the team. Hey, this is a competency, and it's just as equal, just as important as the medical knowledge competency. But this is one area that I think some residents struggle with, especially at the very beginning. Now, how do programs assess your ability in this competency? Well, it's hard. This is one reason why some programs like you to do some US experience. So you work with physical therapists, occupational therapists, case managers, social workers. You understand how all of these different disciplines work together in a teamwork fashion. Practice-based learning. So ability to seek feedback, incorporate feedback, look for self-improvement, look for opportunities to grow and improve, and being able to assess and synthesize medical literature. This is not a easy competency for programs to assess. I think this is probably one of the most important competencies. What does this speak to? It speaks to humility. Many students will try to share with you how great they are, what a wonderful clinician they are, how skilled they are, how knowledgeable they are, I don't know. I think and not false humility, but true humility in terms of identifying areas of weakness that you might have. Show that you have now taken those areas of weakness and make them a strength. And if you can tell that story, especially in your personal statement, you can tell a story about how you may have fallen down, but how you got up, how you now identified resources to help you, and how that now has become a strength for you. That's a great story to tell.
Dr. Chow, I have a question.
Yes.
About that, you mean like I don't know, a personal situation, maybe, I don't know, person that have had like a depression during medical school and then get better, and that could be a good story, for example?
Yeah, so that could be a story. That could be a story. It's sometimes it's it may be that someone encountered a patient and they missed a diagnosis because they did not recognize an injury pattern on the EKG, and then they realized, oh gosh, I gotta improve my EKG interpretation skills, and they studied, they worked with a mentor, and now they are really great at EKG interpretation. In fact, a cardiology mentor thought they were at the level of a cardiology fellow in terms of their ability to read EKGs. That you embraced opportunities to improve, that kind of story. it's it sort of shows the kind of person that you are. Um, that you want to always look to improve. Yeah.
Okay.
That make sense?
Yes, yes.
Yeah.
Thank you.
Yeah. You don't have to be you always don't have to always be so personal. Um, yeah, and this will be this will be an area. This will be a question that'll come up during the interview too. There's something called behavioral interviewing. They when you interview, they'll ask questions. Tell us about a time when you did not succeed, because they want to hear about that. And sometimes that catches the applicants off guard, because they don't want to give a answer which shows that they are weak, that shows that they lack competency in something. But be ready to answer that question. Yeah, I asked that question once to an applicant, and he was a little bit taken aback, not sure what to say. I tried to reassure him that this is I'm not trying to make him feel bad or make him feel like he's walking on coal. But then he said, "Oh, I was part of a soccer team when I was in 5th grade, and we lost the championship match." And I said to myself, well, I'm sorry to hear that, but 5th grade was when he was 10 years old. I don't know, at any rate. But anyways, this would be an important question for Dr. Ravi, because he's a soccer fan. He's almost a professional soccer player. And so he would find that answer to be highly relevant. Now, this competency of professionalism is, hey, this is really hard to get your hands around, both from the program director perspective and the applicant perspective. The assumption is that people are professional, they're respectful, they have integrity, and so how do programs assess this? So your medical school will sometimes identify times or identify examples of when perhaps you were not professional, and that they will highlight that in your application. That would be a red flag. Now, assuming that you don't have that, it's going to be hard for programs to assess this. They may ask behavioral type questions during the interview, like they'll give you a scenario. Believe it or not, this was a scenario that that one program gave. They said pretend you're walking out of the hospital, and you happen to see the program director walking into the hospital, and the program director smells as if he had been drinking alcohol, and is stumbling. And what do you do with that? I thought that was a odd scenario, but I guess it's plausible. But they're trying to get at this. They're trying to dig beneath the surface of the applicant and try to see how, in terms of how they would answer that gets to their sense of ethics and their responsibility to patients rather than to hierarchy or to authority. This is something that you would hope your letter writers might speak to, that your medical school might address in terms of their MSPE letter. Communication. Hey, so this is something that it's communication with patients, communication with peers. It's also documentation in medical records. So this is something that you would hope letter writers would speak to. That they could talk about how you communicate with patients, what your documentation looks like. But they will also try to assess this during their interview with you, how clearly you communicate information. your personal statement should be an example of your communication skills, meaning make sure that there's no typographical or grammatical errors. It doesn't need to be a Pulitzer-winning essay, but it just so it looks like you are attentive and you don't. It's not full of errors related to grammar, to spelling. That you're attentive at least to that part of it. But tell a story in the personal statement, but you don't need to create beautiful prose that electrifies the reader. They're not going to use the personal statement as the reason why they want to interview you. They will use the personal statement as a something to learn and gain insight about you, but it won't be the one part of your application that makes or breaks, and it won't be the decision maker regarding whether they want to meet you. All right, so those are the 6 core competencies. And does that help answer the question of what do the programs look for? What do they want? And I would say no. This is what the ACGME is looking for. But from your perspective, I think it's hard to make sense of all that. But the way that the program directors, they want to know, do the students have insight? What motivates them? What's the passion? Are there external factors that motivate them? So internal means something that's inside you. External might be financial factors. It might be other external factors. Do the students know what their learning needs are? Do they have insight into what would help them learn better? What resources do they need? And how do they learn best? Students should have insight into this. Do you learn best when you're in a classroom? Do you learn best when you're home reading by yourself? Do you learn best when you're doing questions? Or do you rather read a textbook for information? What's the best methodology for you? And it's different for each person. We hope that students have insight in, each person has insight into this. And I hope that you would after all the years of going to school. Now, how do programs, they would like to know what it is why you have such passion. And that's not easily found in your ARIS application. It's not easily found in your letters of recommendation. I think that's the story that should come out in your personal statement. What is your passion? Where's the source of your passion? Okay, now, and then how do you as a student measure success? What are your metrics for success? So we want to know what drives the student. So we look at the ARIS application, and it can look like a fancy, beautiful sports car, right? It looks all shiny, looks beautiful, and it just like your ARIS application. Everything looks pretty and nice, and everything is buffed up. But the key for program directors is, what's the fuel that drives this car? What sustains that passion? And that's it's different for each of you, but I think that's a question that that you should try to answer, because it's different for each of you. And is that passion sustainable? Is it something that is going to last for at least the term of your residency? Okay, now they want to be sure that your transition from medical school to residency is a seamless one. It's something that will be easy to bridge and cross. How can they try to make that assessment? So this is I've got the link here in the heading. This is something called the individualized learning plan. This might be something you should try to access and try to fill out before you go on this journey of applying for residency. Is try to figure out, hey, where am I in terms of taking history, doing a physical exam, doing procedures, writing orders. So it's why do this? Because it has, this is the practice-based learning competency, that you have the ability to look inside of you. You can assess your own performance, and you can do that in a way that is objective. I mean, you can mark 5 all the way down on this far right column here on this form, and sure, you could be extremely prepared in all these areas, but I guess the goal is for you to have some insight into some areas that might be areas for improvement, and then to articulate what those areas of improvement are, and then when it comes time for your interview, that be transparent. Say, gee, I've reflected back, and these are the areas that I think I can work on. I want to improve on. If you don't have any areas for improvement, then you don't need residency. Then you don't need fellowship. You can just go to work for Dr. Ravi and be done with it. But if your interest is to go into residency, then you're going to go into training, and training is a period of improvement. Okay, so this is called the individualized learning plan, and many programs, when you begin internship, they'll give you this document to fill out, and they'll have you work on this with a mentor and begin to shore up self-perceived areas of improvement at the beginning of residency. So here's a sort of a schema about how you progress in medical school. So you take any competency, for example, medical knowledge, and at the first year medical school level, you're at a lower level. Then you gradually increase, and then by the time that you're a 4th year student, then you are at a 4.5, and the level that is expected for you to have achieved in order to graduate medical school is a 4. So then you've achieved, you're above that level that's expected. You're at this is the milestone model. You've achieved that level for the milestone of medical knowledge at the level 4.5, and then you can go on for residency. So program directors think in terms of this model of achieving milestones, and in each of the competencies, each of these areas, that you're gradually progressing from a learner at the early level to someone who's at the 4th year medical student level, now much more experienced. So think about how you perform in each of these competencies. Identify perhaps one or two that you would like to focus on, something that you might talk about during your interview. These personal characteristics, these areas in the realm of professionalism, like integrity, altruism, humility, compassion, dedication, intellectual curiosity, professionalism. How does a program make an assessment about those personal qualities? It's hard, right? But I would like to get some insight into an applicant's these personal characteristics. How do I learn about that? Well, it might be talked about by your letter writers. I hope that it is. I hope they are, because that would help, and that would mean, first of all, that your letter writers really get to know you, but these personal characteristics are probably more important, at least to me, than some of your academic accomplishments. But how do you make these personal characteristics stand out? And you could do that during the interview. how does that work? So so these are these personal characteristics here on the left side of the screen. And then during the interview, they're going to ask you, they're going to say to you, oh, do you have any questions? And every faculty is going to ask you, do you have any questions at the end? Right? And what questions you ask might reflect upon your personal characteristics. So for example, if you ask, hey, how can this program get me into cardiology fellowship? What do you think about that? How does that reflect upon your personal characteristics? Does that reflect upon your altruism, your humility? On the other hand, if you ask the question, how can I participate in quality improvement at your hospital? That shows that you're interested in helping improve the care of patients at that hospital. It shows that you have, so that's an altruistic attribute. It shows that there's interest in improvement, which I think speaks to cultural humility. What resources are available to me to learn new skills? What does that mean? That shows that, hey, I want to get better. I'm not so much interested in beating my chest and proving how great I am. I want to get better. I want to learn new skills. And also, I'm someone who all I need is the resources. I can use those resources and I can make the change, hopefully myself, or I want to be able to try to make the change myself. So this shows professional integrity and professionalism and humility. How do I contribute to the education of medical students? That shows that you have interest in sharing your knowledge with others, that you're interested in teaching. And so I guess what I'm trying to get you all away from is trying to beat your chest and prove how great you are, that instead show how humble you are, show how you're interested in the welfare of others and not necessarily yourself, that you have compassion for your fellow learner. And what mentorship is available to help me improve, that I'm interested in improving. I'm passionate about getting better. Is there what mentorship might I receive to help me in that journey? So you see how these kinds of questions will speak to your personal characteristics, and the type of questions that you ask reflect upon. Well, they can be interpreted to reflect upon your how you view the world, what your worldview is. My main message is communicate with your passion. What is the fuel that drives your sports car, and connect with your humility. And I think program directors would love to see that. I'd like to hear from you all, and also perhaps Dr. Ravi might have some comments that he would like to share. Maybe there's things he wants to shoot down here.
Thank you, Dr. Chow. That was absolutely a gold mine. What's interesting is I don't think applicants really learn about this through the core competencies. So a lot of program directors have to think in these core competencies and evaluate students and residents in US graduate medical education programs. So if you incorporate this, like, okay, the program directors really want to prioritize, say, communication skills, so that you will be evaluated on during the interviews. So that's really important. Then professionalism is very important. Look, at the end of the day, programs, myself and Dr. Chow, want residents that are kind, compassionate, willing to help. We have a patient population. We have a very sick patient population, and it's a privilege to service this patient population. So when you are in residency, you will be helping a very sick patient population. You'll be helping them, a very scared, very nervous patient population, because they don't know what they're suffering with, and you have to diagnose and then tell them and guide them and give them support and give them respect and humility and all these wonderful attributes that Dr. Chow told you about. So to be in a program, we want people that are team players. We always mention this, being a team player is very important. So that's part of this practice-based learning or system-based practice as well. I did put in the chat, system-based practice. Dr. Chow hit upon a very important concept, the integration of social workers, physical therapy, also case managers. These are very important. I have currently a large number of IMGs in my program that have just started, and these concepts are foreign to them, so they're learning about it. But the better you are acquainted with this, the better you will do in trying to integrate them early in the discharge process. So knowing that also will be very helpful. There was a great, Dr. Chow, I'm going to seek your advice. And if anybody knows, like Dr. Chow is like having Brad Pitt at our conference here. So there's an inside joke about that. But yeah, that's how of a superstar Dr. Chow is, and a great program director, well respected amongst all the community here in Maryland, and also nationally at the program directors meetings, and also national ACP is very well known. So a lot of people know him in high places. So there was a question about, are we supposed to address areas of improvement in our personal statement? So I think I attended this before, and I thought this was the presentation you gave for the Dr. Williams Student Conference was very powerful. I'm glad you brought it to this forum. And I think you talked about how personal statements, we read a lot of personal statements. They're usually about, my family member was sick and then I saw the doctor, and then because of that, I wanted to become a doctor. And I think 60% of letters are like that. And frankly, I listened to another presentation by a program director, I think, a dean at a medical university, and they mentioned, don't do that. Never write, because everybody else is writing that. And that is the most kind of mundane kind of personal statement. It's very, we do respect that, okay, somebody was ill in the family and so on, but everybody's writing that. So what makes you stand apart with your personal statement from other people? So how can you make your personal statements more attractive and involve it? Like a program director reads it and is like, oh, I really like this personal statement, and I really want to meet this person. So that helps you in trying to garner the interest of the program director in your application. Like Dr. Chow said, the fuel, what fuel are you adding to your CV? Now, everybody looks great on paper, but we're trying to pick apart who will buckle under stress. And residency is very stressful, and a lot of people will show their true colors in residency when they have stress. People will start acting up, people will start getting unprofessional, and that's what we're trying to avoid. And I'll ask Dr. Chow about that personal statement question.
Personal statements can be personal. I don't, you have to be comfortable with what you say in the personal statement. It's going to be read by faculty members. It may be read by chief residents. So that's you have to be, in the end, what you write in the personal statement should be, it's stuff that is outside of the content of the ARIS application. The ARIS application will mention all of your accomplishments, you did this in medical school, you've accomplished a lot in medical school. But the personal statement should do is explain, it's the thread that explains the rationale of what happened during medical school. Hey, what was it that drove you to pursue a research experience? Why did you do that? It shows up in your application, but why? What is your interest there? So the personal statement might be the rationale for that, explains how things occurred, why things occurred, and what order they did. It gives us insight, understanding of the person. I think that would be now. Now, I agree with Dr. Ravi that a lot of personal statements will talk about a family member or patient, I think that's okay if that's where your passion came from. If you you weren't sure what specialty or what you were going to do, but then you came across a patient or a family member had an experience, and that was a spark that got you interested in a specialty. It's okay to explain that, but then I would like to hear about what you did to ignite that spark, how you matured that interest and sustained it over time. That you may have got that interest early on in medical school, but then you explored, you probed into it, you looked at, you did additional rotations, you got research experience, that you were getting more and more in a you dug deeper, and that's the kind of person you are, that you go beneath the surface. So it yeah, I don't know, so I think vanilla is a good flavor. I don't I recommend folks don't take chances with the personal statement, that you can explain yourself. Just make it make it sincere, make it honest, and not everyone has a story that is so compelling, that is so overwhelming, that that's fine. That we I think there's don't put too much effort and energy into the personal statement, in the sense that it's overwhelming to and such a big hurdle. It's not. It's just it's something that people like to read, to find out what brings all of the components of your ARS application together. What's the overall, what is the theme?
And to sort of add to that, there was one letter I had. Sometimes some people want to convey that they have good handle on English and vocabulary and grammar, and some of these letters are just full of complex word verbiage, and then you start thinking about the words and trying to decipher them, that you lose the message of the letter. So make it simple. You don't have to put in like high level English literature, Shakespeare, or anything like that, and try and convey that you have a good handle on English, but make it very simple. And moving on to another question, that how do program directors look at applicants that lack USCE? I think that's a really important question. And there was another question, that should we talk about US clinical experience in our letters? I think you already have that box on one of the experiences. You have that box there, and it's already in the application. So use your personal statement to highlight something that's not in your experiences, or your highlighted experiences, or the experience that you really want to convey on your application or your CV. Use it to convey another message. That way you maximize the insight that programs have on your background. But what do you what would you say about US clinical experience? If somebody's lacking it, does that make them a less attractive applicant?
So we don't require, our program, we don't require US clinical experience. US clinical experiences vary tremendously from one place to another. In fact, Dr. Ravi, you probably just got the program director survey, and I'm part of the team that is surveying program directors about what they think about US clinical experience, because there's so much variation, and also there's predatory rotations out there. So we as a program don't require it. If people have it, I hope what I do is I look at the letter from that experience and see whether the letter is insightful, whether the letter describes that they seem to really know the student well and can advocate for the student in a specific way.
Absolutely. I think nowadays rotations or US clinical experience have become very financially involved. And then from my viewpoint, I want to make sure we have access to applicants that don't have a large amount of financial funds. So we don't want to just give importance to those that have a lot of US clinical experience because they're able to travel around the US and spend money and spend their $4,000 at X university to do a rotation. It looks great on the application, but I also want to give as much time to the underdog who doesn't have those funds and wasn't able to do that. So be mindful that this predatory that Dr. Chow mentioned. You have to be really careful. We could name many places, many attendings having these groups where they ask for money to rotate, and then they generate this. Dr. Chow probably seeing the same letters that are just the same standard letter. And I had two applicants that had letters. They rotated with the same place, and the letters were exactly the same, just the name was changed. In one of them, the name wasn't changed. So just be careful. And then the big thing about research, right? Now this came out about these programs or these things set up to generate publications for people that are just like it's not done in a appropriate manner. I guess it's sort of to cheat the system. So you also be careful that you could also ask that question: do we need a lot of research? Frankly, no. Not all institutions, especially community programs. Nowadays, we have community programs, we have academic programs, and we have hybrid community academic programs that are acquainted with a university and then sort of take on those academic attributes of a university. So university community programs won't be heavily invested in research. And nowadays, a lot of university programs are taking few IMGs, and again, you don't have to have a great deal of research in that regard. Let's see, Deborah, any other questions coming up?
There's one like from Isabella. What level of detail do you expect in terms of the discussion of future goals in the personal statement?
Yeah, so I can address that. So let's say that you're interested in becoming a academic career, academic faculty member, perhaps in the future, and maybe in a subspecialty, then which is fine. That's a very good aspiration. But then you'd like to see I would like to see that there's a trajectory towards that career endpoint. So if you say my interest is become an academic nephrologist and practice at an academic medical center in my future career, there should be a trajectory that there's maybe some research that you've done in that area, that how did you gain that interest in pursuing that career endpoint, and then describe. But if you describe your future aspirations, but there isn't a logical pathway towards that endpoint, then that doesn't make sense, right? So when someone asks about research, so if you're, on the other hand, if your interest is to become a practicing primary care physician, which is a great attribute, by the way. I'm a primary care physician, and I love primary care. And if that's your interest, then research is not certainly critical to that career endpoint, and there's no need for someone to have a large research dossier. But I think if you're going to say, I want to do primary care, or you want to do an academic, there should be some rationale. How did you arrive at that decision point, and and you should have walked down that path a little bit. That is because otherwise one would wonder, how do they make decisions? How do they decide that they're going to do that if they haven't had any experience in that field? They haven't had a rotation in that area. How does this person make rash and quick decisions without a lot of thought and experience. That would be the kinds of things you might explain in your personal statement.
There's one question: how the experience as a rural doctor is evaluated by a big city IM program. I think that would be of a high amount of interest to me, because we're looking for people with different backgrounds. So we want a very diverse resident population. We want people with different strengths, different areas of expertise. We actually, a lot of internal medicine programs are now incorporating a lot of ambulatory rotations, a lot of clinic to underserved areas. So our program, Dr. Chow's program, we have a large underserved area or population with a lot of health problems. So this will be very helpful, because I can imagine working in a rural area, you connect with your patients, your patients know you, you will have you'll bring a lot of attributes which sometimes in a large city program you don't connect with patients. Patients are just looked at as per person on the list, and you just see them, write a note, get moving, and go on to the next patient. Whereas here, we want to have you make connections with our patient population, see the same patients in the outpatient clinic, also in the specialty clinics, and so on. Any input on that, Dr. Chow?
So I agree that we all programs are under the gun to be have a diverse residency program, diverse not just in terms of ethnicity, but diverse in terms of interests of the residents. Yeah, I would. Yeah. So I don't know that we at our program we had a little trouble with gender diversity. We were attracting more. We were matching more men than women, and so we had to work on that. And we got a lot better at that. But this is a every program is focused on trying to make sure that they have there's a wide range of resident interests, experiences, backgrounds, and that just adds so much to the program.
There's one question: if in the program there is categorical and primary care track, should I choose only one? I when I did residency, I did it in a primary care track because I knew I wanted to go into primary care, and I loved my primary care track. You should choose the program that best fits you. If you're interested in primary care, yes, apply to a primary care track. If you're interested in primary care, look at programs that have primary care experiences, but don't apply to a categorical program and the primary care and the primary care track just because you want to have a wide net. They're usually pretty different experiences. The people go into the categorical program, if there's a primary care track, those in the categorical program might be more interested in hospice medicine than primary care, and your experiences might be more in the hospital than in primary care. Yeah, I think we're maybe a little over time, but I think because it's a personal statement session, but I just wanted to spend a few minutes. I think this year, I wasn't able to go to the National Program Director meeting this year, but signaling has been expanded, and I think a lot of IMGs have difficulty. Last year, I told a lot of people to signal, and then people like, I want to go everywhere. Don't want to narrow myself to programs, and then they lost out because signaling. I think the data from signaling was we prioritize the people that signaled us first. So this year now we have 15 signals. What was the message from Aptum about that?
Well, I'm very conflicted about this signaling process. I know that for international medical graduates, they apply to a lot of programs, and it's not this signaling algorithm. Where do they get the number 15? they got the number 15 because if you have 15 interviews, then the chances of you matching is somewhere like 98%. So so that's where they got the 15. Now, this is for, so that is true. International medical graduates, US medical grads, if you have 15 interviews, then you're very, very likely to match. And that's good. On the other hand, how do you get 15 interviews? Now, for US medical graduates, they might only apply to 20, 25 programs, and they might get 15 interviews. International medical graduates, they have to apply to a lot more to get 15 interviews, I think. Maybe I'm wrong. This is this whole signaling thing, I think, is biased towards US medical students, and it gives me great consternation. I don't know what to tell you. I will say this, that some programs, the reason why they created the signaling process is to reduce the number of applications that a program has to review. Now I'm not sure how many you all get, Dr. Ravi, but we get 4,000 applications for 9 positions. I'm sure you guys are probably somewhere in that neighborhood as well. It's hard to read 4,000 applications. So some programs have said, hey, I'm only going to review those applications that signal us. And so if all of a sudden I just decide I'm just going to look at those folks who signal us, that might end up being 800 applications. I'm going to review those 800 applications. Well, what does that do? That eliminates 3,200 applications right out of the gate. I think that's a shame. Because your application should not be based on whether you're signal or not. Your application should be based on your qualifications, your performance during medical school, and your qualifications and your accomplishments, not whether you signal a program or not. So I'm concerned about this. Last year there was only 5 signals, and that was easier to, was it 5 or 7, something like that. And frankly, we didn't pay much attention to it. And people signal us, whether they signal us or not, we invited them, and I didn't do much with it. But this year, I think there's going to be there'll be a lot more programs who just look at those applicants who signal you. Now, what does that mean for you as an applicant? You have to be judicious about your signals. Okay, so you can send 15 signals to the Ivy League programs, and God bless you if you can get interviews for interviews there. That's great. But if you use up all your signals on the aspirational kind of programs, then those programs that you don't signal, but those programs at which you will likely to be a good candidate for, and you didn't signal them, they may not invite you. So this is it's challenging. It adds a level of complexity beyond just the application itself.
Absolutely, yeah, I agree with that too. It'll be interesting this season with so many signals, so definitely use them wisely. And there was one question, like I've had applicants send me, well, they make personalized personal statements. So if they apply to your program, they'll insert then university. It's a pleasure to be interviewed at the University of Maryland, and they've applied to me, and pleasure to be interviewed at Sinai. Frankly, I think it's just too much. It's a lot of use of your time trying to edit. And what if you make a mistake in that editing and send the wrong personal statement? Then it'll look bad. So I don't really care for those. I think it's just time not well invested. You can invest that time in something else, preparing, doing mock interviews and things like that. What is your take on that, Dr. Chow?
Yeah, don't do that. But on the other hand, we've had people who say, I want to come to Baltimore, and I want to come to Baltimore because my significant other is a attorney who works for the U.S. government, and they have to be located in the DMV area, and so that's fine. And so then I think to myself, okay, this person's going to look at us, they're going to look at Sinai Hospital, they'll look at MedStar. That's fine. That I'm that yeah. If that's your case, and you have to be limited for personal reasons, go ahead and say that.
I think that's great. Yeah, we have a lot of applicants that their significant other is in the military. We have a lot of military bases and things around here, or they're in industry and government or the tech industry. That's a great thing to put there, because that then we prioritize people that want to be in this area, which is a very, very great area to be in, being very diverse with so many things in this area, in the DC, Maryland, Virginia area.
Ravi, I
Yep.
think we talk a little bit of everything, but if you and Dr. Chow want to give, I don't know, say like what to do and what not to do on a personal statement, like 3 things, and we can go ending the session.
Yeah, I guess.
I'll go ahead.
Go ahead.
Number one, that Dr. Ravi talked about a very beautifully written personal statement. So I when I interview folks, it becomes very apparent if English is your second language. There's nothing wrong with that, and that's fine. But then I read the personal statement, and it looks like it came out of a English textbook, or it's a beautiful work of prose. And then you realize this personal statement is not that personal. It probably got edited and massaged by someone else, so what I'm saying to you is, own your personal statement. If it's okay if there's some slang or something there that's that shows that English is not your first language. I think that's fine. That personalizes it. In fact, I'm not. You don't have to make it the perfect piece of prose that you can publish in a English literature. Yeah, and so make it personal. Second thing is, don't do AI. You can go to AI and tell AI to write a personal statement for you, and it'll generate one. Program directors have become sensitive to seeing when a personal statement is sort of created that way. It's a little bit; those tend to be sort of generic, not personalized. It's not your story. It's a Microsoft story, and then the third thing is, keep it to one page. All right. If it's more than one page, even if it spills over to the next page, I'm reading it and I'm going to say to myself, why is this applicant making me read more than one page long? This better be good. It makes me feel like whatever message you have, it should be able to be fit in less than one page.
Oh, those are great. I just love that. Yeah, the use of AI is very important. Be very nervous, because if you're using AI, then somebody else is using AI, and AI will generate the same sort of thing unless you feed it different information. But I think it's okay to use Grammarly to fix your grammar, which is okay. You can download you have Grammarly look over, and it will fix your grammar, which is fine. Nowadays, everybody's using that, and that is okay, because it won't alter the structure of your personal statement. So I think use your personal statement to reflect on things that are not repeated in your experiences, your impactful experiences, so on. Maximize the use of all that, but tell your life story. And again, we hear, if you join CPS, and I always say why I'm a big advocate for CPS and for trainees to join CPS and learn, because this is a background. And like Dr. Chow, all the residents tell me he runs a fantastic morning report. And actually, Dr. Su told me, yeah, this is what Dr. Chow does in his morning reports. Goes through each aliquot and discussing, and gives a lot of knowledge and pearls to his residents. So this is sort of the backbone and tradition of learning in the US and in a lot of places. So I think attending CPS is very important to at least have insight into the US medical training experience. And also when you write notes, they're pretty much in the same how people present, right? So the HPI, past medical history, and so on. So you get used to that. And so that's very important. But getting back to personal statement, in the personal statement, talk about something about life experiences, something that impacted you, which is not in one of those experiences. Talk about weaknesses. So in your impactful experiences, maybe you won't talk about weakness, but where there was a weakness and where you had a solution. And that portrays to us that you are a human being and nobody's perfect. So for instance, I had students in my sim lab yesterday and they did not weren't able to figure out the case, but it was then my job to help them. So to diagnose the learner. So the same thing, if there's a weakness, we don't look down on it. We're like, oh, all right, somebody was able to get over this weakness and improve or find a solution, because there's going to be, when you're walking into residency as an IMG, you're going to have a lot of weaknesses. Writing notes in EMR, presenting and so on, and we have to teach you all that. So these are all going to be weaknesses, and everybody's on the same sort of playing field at that point. And it takes a few months, then everybody's running up to speed then with these workflow issues. I think also, just tell your story, I think, and keep it to one page. If it's long, we have to read a lot of personal statements and also letters of recommendation, like a letters of recommendation, another thing too. But keep it to one page, but tell us about yourself. And it doesn't have to be, somebody asked, like, should it be medical? I like the personal statements that really don't go into medicine. Like, I did X, Y, and Z rotations at New York City Medical, whatever, and so on. Okay, that's fine. You can do rotations. We do rotations and so on. But tell me something, maybe an interaction with a patient. You had a patient. I had a student, for example, student, and we were discharging a patient, and the patient didn't have access to diabetic medications, and the team almost discharged the patient, but the student stepped in and stopped the discharge because of this whole pharmacy, insurance, and so on. And they prevented a major adverse event with the patient going home and not getting access to diabetic medication. Or I had one student that there was a family that had an issue, but they spoke Spanish. They weren't able to understand. And the student then went in and translated and helped and spent their own time helping. And the outcome for the family was very good. So that is something that I would put in there that you were able to do. It's not, again, boasting. I guess it would be something that you've done that's non-medical, meaning diagnosis, treatment, and so on, but something that's humanistic as well. So again, like programs, we're looking for people, we're bringing people from all parts of the world together who have never worked together, and it could end up being sometimes a pressure cooker with stress, everyday stress, life stress, and taking care of many patients, and it can become difficult. So can people cope with life? Overcoming, I had actually one person who talked about injuring themselves. They fell off a rock. They went rock climbing and fell off and injured their leg and had to do rotations, and then was overcoming all of the difficulties and did well in their rotations, and they had to wear a cast and all that. And I was like, that's very interesting. Yes, you overcame a lot and you still worked through and persevered. I think that's very important. So there's always something. I mean, luckily not all of you had these kind of injuries, but just an example. Anything else, Dr. Chow? A lot of different things we kind of put out there, but
can I? I'm just going to share a reference because I want to be sure that you go. This is an evidence-based presentation after all, right? I want you to be able to say that. All right, so this is this is part of the presentation I gave at ACP okay, so here there's a reference here. It's from New England Journal 2021. And it's you can find some literature on what goes into a personal statement. There's also a article in the Journal of Graduate Medical Education, JGME, which also talked about personal statements. This was what I sort of a template that the spark that ignited your fire in terms of your interest in internal medicine, and then how you fuel that fire, how you mature that interest, and then what you foresee the future being. This is a very common template that people use, but you can have different formats and tell a story. Don't criticize controversial topics like the president of United States or Medicaid or Congress, Affordable Care Act. Be careful about that. I see a lot of personal statements which they start with a quote from Steve Jobs or a quote from Osler. I think that's okay. We get a lot of quotes. I wonder about you as a applicant distilling all of your fundamental work and your morals and your ethics, and someone else giving voice to that Osler speaks for you, or Steve Jobs speaks for you, or Elon Musk speaks for you, that you're so at any rate, I'm not that's a choice that people make. Okay, so that was that. I know we're way over time. Again, I apologize at the beginning. I was late because I'm technically incompetent, but that's not one of the 6 core competencies, so that's okay.
Yeah, that's true. Technology is not in there, so I absolutely agree. But thank you, Dr. Chow. That was invaluable. It is. I'm just appreciate the amount of time you spent with us today and all the insightful knowledge and all the recommendations that you gave us today. Yasmin, Deborah.
Thank you so much. Oh, go ahead, Fran. Go ahead.
No, thank you so much. It was really good to have you in this session. We really appreciate your time and the PowerPoint. And yeah, we are gonna wait for until the end of the year. We'll receive the Maryland Internal Medicine Program to present a case for us.
Definitely, we would love to have both of your programs participating on our IMG initiative cases. And again, thank you so much, Dr. Chow. It's okay, like technical difficulties happen, but we really appreciate all of your insights as IMGs and applicants this year. Thank you so much.
Great. Any parting words, Dr. Chow?
Oh no, it's exciting to meet you all, and I think it's going to be an exciting interview season. I look forward to it. Thank you for organizing this. Always an honor to speak with you all, and always good to see my friend Dr. Ravi.
Yeah, likewise. Always, I'm really happy to have known Dr. Chow, and actually, Dr. Chow was an APD at my program many years ago, so we do share a relationship going many years back, and do apply to Dr. Chow's program. He's a fantastic program director, and he takes very good care of his residents, and they have a very well-known program, well-respected program here in Baltimore. So thank you for coming, Dr. Chow. Take care, everybody.
Thanks.
Bye.